my name is Rasha Fadlallah, and I'm a Senior Evidence Lead Specialist at the Knowledge 2 Policy Center. I'm also a Senior Systematic Reviewer at SPARC Center, which is the Center for Systematic Reviews on Health Policy and Systems Research. And we are established at the American University of Beirut. I have my colleague Lama Bukaroum with me.
Hello everyone, I'm Lama Bukaroum. I'm a Senior Evidence Lead Specialist at the K2P Center and Systematic Reviewer at SPARC Center.
So Lama and I will be co-facilitating today's webinar on priority setting for health policy and systems research. And this webinar is part of K2P's mentorship program. Okay, so as you can see, the objective of today's webinar are first to gain a better understanding of the role of priority setting in evidence-informed policymaking. So why is priority setting important and how can it contribute to the use of evidence in policy and practice? 2, to learn about the different steps involved in conducting priority setting exercise. 3, draw on real-world examples from K2P Center's part and our work at the regional level when it comes to setting priorities for health research. Ultimately, it is hoped that by the end of this webinar, the information shared will help you in developing your own tailored priority setting approaches and tools as part of institutional capacity development. And of course, we aim for this webinar to be interactive. So this is not a one-way flow of idea. We would like to hear from you and we encourage you to share your experiences as well. And please feel free to ask any questions along the way. And if you think we are speaking too fast, please do alert us. So if you don't have any questions, we can proceed with the actual webinar. And I just want to point that we will be recording this webinar, so I think it's better to mute. We will mute all participants, and if you want to talk or have any question, you can unmute yourself, but because of the clarity issue, I think it's better to mute participants. So we're participants.
We also can mute ourselves.
Okay, so maybe we request that you mute yourself, but please feel free to unmute yourself whenever you want to intervene or you have any question.
Okay.
Okay, so Lama will start with part 1 of the webinar related to the role of priority setting in evidence-informed policymaking. Lama?
So to start our webinar, are you all familiar with the concept of evidence-informed policymaking? A question for you.
Yes.
Yeah, yes, we are.
Okay.
Yes, we are.
Perfect. So what is evidence-informed policymaking? Evidence-informed policymaking is an approach to policy decision that aims to ensure that decisions is well informed by the best available evidence. It is characterized by systematic and transparent access to and appraisal of evidence as an input into the policymaking process. Evidence-informed health policymaking is important because it can strengthen health systems, drive progress toward universal healthcare coverage, and ultimately improve health outcomes. Can you see our screen?
Yes, we see. We can see.
So are you seeing the slide?
Yes. Yes. Okay. Okay. So why evidence, mainly from health policy and systems research, is important to inform policy decisions. Health policy and systems research can produce reliable evidence which help to inform critical decisions, including who delivers health services and where and how these services are financed and organized. For example, if a Minister of Health is struggling to decide whether to introduce pay-for-performance to motivate healthcare workers, evidence from HPSR can inform such decisions. And it also can inform, for example, what strategies are effective to promote equitable primary healthcare to all. However, evidence from health policy and systems research is still underutilized in policymaking in low and middle income countries. One of the key barriers to integrating research into policy making in these settings is because the research evidence is not relevant to policymakers' concerns. To address this, there's a need to engage policymakers in research priority setting exercises. So, what is a priority setting exercise? Can any one of you give me a definition of a priority setting exercise?
Well, so we can use different approaches. Like it's not like, I think so that it's not kind of, it's don't have, I think, the gold standard. It can be like meetings with stakeholders, like to ask them what the reforms or changes they're going to develop, and then to start like to prioritize several of them, which needs to be supported by the evidence and in the what time frame. This is general from me.
Yes, thank you. Anyone else can give me a definition, or shall I proceed? Okay, so
Well, yes, can you hear me? Priority setting, it's like she said, is a general, is an approach to sieve within the various needs for researches, various things that ought to be done to address situations. There are several of them, but considering the fact that you cannot begin to address all the problems that you are seeing, there should be a way to look at priority-wise, which one would everybody agree that this is most pressing, and then we choose to do it. So just to look at it from that perspective.
Yes, thank you. This is great. So as you said, there's no one definition for priority setting. Priority setting, as defined by the Alliance for Health Policy and Systems Research, is a program to generate consensus about a core set of research issues that urgently require attention in order to facilitate policy development. Another definition is a notional approach to find out what to regard as more important or less important in healthcare. It primarily means to bring aspects into a ranking order. And why priority setting is important? Priority setting or prioritization process can create a set of agreed upon priorities among different policymakers and stakeholders. It can increase the likelihood that the best available evidence inform policy decisions. And it can promote optimal allocation of scarce resources. It can also maximize impact of our research. And it can also strengthen your application, grant application and funding requirement. And as you all know now, funders are interested in reducing research waste. So when you show funders that your research responds to a policy priority, this will increase the probability of your research getting funded. So there are existing tools and approaches. There are existing tools and approaches in the literature for priority setting, but these approaches mainly focus on they are mainly for health in general or for clinical research, but no one is specific for health policy and systems research. These approaches cannot be applied, or they have limited application in health policy and systems research because they focus on a disease-driven orientation, and they lack transparency in the prioritization process. And they also are time-consuming because due to the involvement of multiple stages and multiple iteration process. And they have also an inexplicit criteria for decision-making. So this is why it's important to have, or there's a need to have a priority setting approaches and tools specific for health policy and systems research, which allow the movement from a disease-specific approaches to priority setting to a system approach. Moving to a system approach is very important because it can help in the health system development and into addressing other cross-cutting issues like the social determinant of health and the SDGs, as you all know. I will leave now the floor for my colleague Rasha so she can proceed.
So do you have any questions before I move to part 2, which is related to the different steps involved in conducting priority setting exercise? So in the first part, we looked at the importance of priority setting and how it is linked to promoting the use of evidence-informed policymaking and practice. We also highlighted the fact that although there are many approaches in the literature for priority setting, these approaches are generally linked to priority setting for health in general or clinical. So there is no specific approach for health policy and systems research, especially when we're talking about prioritizing topics for evidence synthesis. So remember, we are not prioritizing primary studies, we are prioritizing topics for policy briefs, we are prioritizing topics for systematic reviews, and these topics are focusing on health policy and systems research. So when you look into the literature, it's a bit challenging to find the ideal approach that would fit evidence synthesis and health policy and systems research. So in the next step, I'm going to provide an overview of the different steps involved in conducting priority setting exercises. So from your perspective, what steps need to be undertaken during a priority setting exercise? So let's say you are planning for a priority setting exercise. How would you proceed? Would anyone like to answer this?
I will start. This is Leila from Croatia. So first of all, we will draft an email with a request for meeting with specific stakeholders we want them to have during a meeting. And then when we, during a meeting, when we attend this meeting, we will ask them what is the priority settings they would love to have best available evidence from different kind of knowledge translation products that can be prepared within these or other projects. So at first the email and then meeting, and during the meeting we will ask their opinion about, so we will ask all of them opinion about the priority setting topic, and then together with all participants we will find out which is the most priority topic.
So yes, definitely this is one way of doing a priority setting exercise. Does anyone want to share their experience?
Just want to add maybe that before starting the meeting, maybe we will start with identifying the stakeholders. So to start with identifying who are decision makers and who will be interested from the different institutions, such as Ministry of Health or National Center for Disease Control, or from the Parliament, and so on. So before the meeting and before the email, probably we will start with identifying the possible stakeholders and possible decision makers who will be interested and who should be involved to have the maximum engagement of all stakeholders in priority setting exercise.
So definitely stakeholder involvement and identification is a critical step when we want to do a priority setting exercise. So this slide in front of you provides an overview of the priority setting process. As you can see, it's divided into 3 phases. We have the pre-prioritization phase, we have the prioritization phase, and we have the post-prioritization phase. Within each phase, we have different steps. And we do acknowledge that there is some overlap in some of the steps across the phases. For example, although we included stakeholder involvement in the prioritization phase, stakeholders can also be involved in the pre-prioritization phase as part of generating the initial list of topics. They can also be involved in the post-prioritization phase through dissemination and implementation of priorities. Similarly, although we included monitoring and evaluation in the post-prioritization phase, ideally monitoring and evaluation should encompass all the phases, but for simplicity, we kept them as they are. So it's important to clarify that you are not expected to do all these steps every single time. In fact, because of the different context for which priorities can be set, the optimal combination of steps varies per country as well as per priority setting exercise. This means that you have to customize the steps to your own context and your own needs. For example, if you look into the literature, you will find that many of the studies include generation of initial list of topics, stakeholder involvement, use of prioritization criteria, and dissemination and implementation as key steps for the priority setting process. However, the way that they generate the topics, the stakeholders that they involve, the involvement mechanism, and the criteria that they use will definitely vary across setting and studies. That's why there is no one best way to conduct a priority setting. It really depends on your own context, your need, and the purpose of the priority setting exercise. So in the next slides, we will dwell into the details of each of the steps. Okay, so when planning a priority setting exercise, it would be helpful to establish some guiding principles, and these principles will help drive the entire process. This includes practical considerations about available resources because it will have implication on the number of priorities that you can eventually address. You also have to consider the scope and the focus of the exercise. So am I focusing on health policy and systems research, or am I focusing on public health? You also have to consider the level. Is it at the national level? Is it at the regional level? You also have to consider the values that the stakeholders adhere to. Do I want my priority setting to be driven by equity? Do I want an equity lens? Or maybe I'm more interested in cost effectiveness. It's also important to analyze the political environment. So who has the political power to set priorities? Who has previously set priorities? Who has a say when it comes to this topic? Of course, this has implication on the stakeholders that you will eventually invite to the meeting. You also have to decide on the need for ethical principles. For example, if you are working on priorities related to pharma, you definitely have to take into consideration the issue of conflict of interest and how you can manage conflict of interest among participants. So the guiding principles really depend on the focus, the nature and scope of the priority setting exercise. A next step to consider in the pre-prioritization phase is the generation of initial list of topics that will later feed into the actual priority setting meeting. So what are some ways to generate an initial list of topics? What do you think? Okay, so there are different ways to generate an initial list of topics that will later feed into the actual priority setting exercise. One of the most common ways is to conduct a review of the literature. This is because to be able to prioritize research, you must first know where the gaps in knowledge are, and a review of the literature will help you in identifying those gaps. And the literature review can include a review of primary studies conducted in your country or region. It can include a review of WHO reports, as well as review of documents produced by the Ministry of Health and other related ministries. You can analyze these documents to come up with potential list of topics that will later feed into the actual priority setting meeting. Another common way is to elicit the input and opinion of stakeholders on potential priorities. So you can engage stakeholders in two ways. One way is to simply ask them to nominate topics that they think are potentially important. Another way is to come with your own predefined priority area. So let's say we are interested in working around the issue of refugees. So I have already pre-specified the area that I would like to work on. I can then ask stakeholders to propose specific topics under this area. So it really depends on you. Sometimes data from health information system can also point to potential areas that require further attention. So let's say you are looking at the health indicators in your country and you found that there is an increase in the prevalence of mental health, so a sudden increase. This will prompt you to propose topics around the issue of mental health. For example, how can I integrate mental health into primary healthcare? Maybe this is one of the potential topics that you would like to feed into the actual priority setting meeting. Also, sometimes reviewing or analyzing previous priority setting exercise can be useful. For example, the work that we did on drug counterfeit was informed by a previous priority setting exercise conducted in the region. So stakeholders, they identified this as a priority, yet we could not identify any research or work being done. So we decided when we launched our center that we wanted to address this area, the area of drug counterfeit and drug quality. And accordingly, we asked stakeholders to propose potential topics under this area that will later feed into the actual priority setting meeting. And one often overlooked way is the media analysis. So keeping an eye on relevant and recurrent health topics covered by local media can also help give you a sense of what are some of the potential priority areas to consider. So depending on your context, you can use one method or a combination of methods to generate an initial list of topics or themes that will feed into the actual priority setting meeting. So now that we have established our guiding principles, we have generated our preliminary list of topics, we have identified the potential stakeholders, the next step is we are now ready to move to the prioritization phase. However, prior to the actual prioritization meeting, it is worth conducting research gap analysis. So one of the main differences between priority setting for policy briefs or systematic reviews and priority setting for primary studies is the existing knowledge or evidence base. So when we are prioritizing topics for primary studies, we really don't care about the existing evidence base. We don't care if there are already existing studies addressing the topic or not. However, when we are prioritizing topics for policy briefs or systematic reviews, it is very important for us to assess the adequacy of the current knowledge base or the current evidence base. The worst thing that could happen is for us to go to the priority setting meeting, bring the different stakeholders, prioritize the topics, and then come a few months later and tell our policymakers and stakeholders that unfortunately we could not develop the policy brief because we could not identify enough evidence and systematic reviews addressing our topics, so we couldn't develop the brief. What do you think would happen? How would they react? Of course, they would lose trust in your work, and they might also lose trust in the whole concept of evidence-informed policy making because you failed to show them the value and the relevance of this work. So the next time you invite them to another priority setting, the chances are they might not come because they didn't see the value in the first place. That's why it's very important to do a research gap analysis prior to the actual meeting. And when we talk about research gap analysis, we are not saying that you have to do a comprehensive or detailed analysis. It's a scan of the literature. You can maybe spend 15 to 20 minutes to look at the existing literature base and see whether there are at least 2 to 3 relevant systematic reviews addressing the topic. In this way, you would be comfortable knowing that there are at least some studies available out there. And this is linked, in fact, to the workshop we did in Beirut on how to search the literature. So if you recall, we sent you a list of key databases that are specific for systematic reviews. Do you recall them? Can any one of you mention some of the key databases specific for systematic reviews?
Specific databases for systematic reviews are health systems evidence, Cochrane database, and PubMed can be also used with filters.
Exactly. So we have the health system evidence database, which is the most comprehensive database for systematic reviews on health system arrangements. We have the health evidence database for public health topics. We have the Cochrane for clinical topic. We have the social evidence for social topics. And we have the PubMed, which has a filter for systematic reviews. So the best thing to do is to visit any of these specific databases and try to see if there are some, if you can at least identify 2 to 3 systematic reviews relevant to your topic. And in fact, at K2P Center, the research gap analysis is critical because it helps us refine our topic. Sometimes you might have a very broad topic which is challenging. So once you do this research gap analysis and you scan the literature, it can give you an idea of how you can reframe and refine your topic before you move into the actual priority setting meeting. So if you're doing a policy brief, the best thing is to look whether there is existing systematic review, because policy briefs built on existing systematic review. if you are doing a systematic review, you have to scan the literature and see if there are primary studies, because systematic reviews build primarily on existing primary studies. Is it clear, or is anyone confused at this stage?
It's clear.
Okay, excellent. So once we've completed the research gap analysis, the next step is stakeholder involvement. As you all know, a critical step in any priority setting exercise is who to involve. So which stakeholders have you involved in previous priority setting exercises? Or if you have not involved, or if you have not conducted priority setting, which stakeholders do you think should be involved? Anyone would like to share their experience?
Different type of stakeholders, I think. So it should be decision makers, and probably the group who will be affected, maybe the healthcare providers. It can be pharma representatives. It depends on a topic. It can be NGOs working on the topic. So it depends on a topic, but definitely it should not be only the decision makers like from the government. I think it should be the variety of stakeholders, like once again, civil society representatives, patients, healthcare providers, and others and others.
Of course, so excellent, yes. So this diagram summarizes the key stakeholder categories when it comes to health systems research. So we have the government and public policymakers, including parliaments. We have academia researchers. We have health service providers and implementers. We have patient general public, including community members. We have health system payers. We have research funders, and we have NGOs. So even within NGOs, I would say private sectors, including the NGOs. And for example, in Lebanon, we also involve faith-based organizations because they have a say when it comes to implementing policies. So this is the ideal category of stakeholders that you should involve when conducting priority setting exercise. There is evidence that engaging a wide range of stakeholders in the priority setting process can increase the legitimacy, the credibility, the transparency, and acceptability of the identified priorities. Of course, this can enhance the relevance of the generated evidence, which will subsequently promote its uptake in decision-making, because you are ensuring the buy-in of all the relevant stakeholders from the beginning. However, as you all know, engaging a very wide range of stakeholders may sometimes be challenging in terms of feasibility, capacity, and resource constraint. So the key here is not about the quantity, but the quality. So I don't have to invite 20 policymakers and 20 researchers and 20 health service providers. I can simply sample 2 to 3 stakeholders from each of these categories as they apply to my own context. And in terms of the numbers of stakeholders, these can be as low as 10 and as high as 40. Of course, the more diverse the topics are, the more regional the level of priority setting is, the more stakeholders you would be inviting. And the average is 18 to 25 stakeholders per priority setting. What about the engagement methods? How can we engage them? So, any suggestions?
Before engaging them, maybe we should kind of identify who is supporting and who is against of our maybe initiative. And in terms of engagement, it can be different type of engagement, like to invite, to even delegate work to them, like to engage them from the very starting point, invite them a meeting to discuss priorities, then to put them in email exchange, like to see how it develops and what was the outcomes of priority settings. And then even we can engage them in developing some changes according to the evidence product we developed.
Yes, that's correct. So
Sorry.
Yes.
Just to add, another key thing in engagement method is to really ensure that you having identified your stakeholders, and you ensure you bring them together, so that at the end of the day, whatever that is going to be the consensus would have been seen and have been taken up by everybody. That would help in ensuring uptake of whatever evidence that is going to come eventually. You know, some people feel they consult people isolatedly, so it is better bringing them together while doing the engagement.
No, so definitely this is important. This is an important point. So mapping your stakeholder is definitely a key step that you should do to ensure you are bringing the right stakeholders. So you want to have the right mix of stakeholders, and you want to ensure their buy-in from the very start, so that when we later move on to implementation and uptake of the evidence, there is less resistance because they have been involved throughout the process. So this is a summary of a systematic review we conducted on priority setting approaches and exercises that have been conducted, and it's a summary of 20 studies. So one of the most common engagement method is through workshops or face-to-face meetings where the different stakeholders are physically present together. However, this is not always feasible. So another common way to involve your stakeholders in the prioritization process is through online surveys or online voting systems. And increasingly now, people are leveraging web-based discussions and teleconferences as substitute to face-to-face meeting if the latter is not, if the former is not, so if you could not, it's not feasible to do a face-to-face meeting, you can do web-based discussion and teleconferences as an alternative. And in some cases, some people still, they email the priority setting tool via mails and post mails. And of course, you can use a combination of methods. So as we said earlier, that you can involve stakeholders in the pre-prioritization phase to generate initial list of topics, and in the actual prioritization phase to rank the topics. So maybe you can use the online survey to elicit the input of stakeholders on potential topics. You can then hold a workshop or face-to-face meeting to validate and rank these topics. Alternatively, if you have a very long list of topics for prioritization, you can start with an online survey to bring the number down to a manageable number. You can then do a workshop or face-to-face meeting to subsequently rank these priorities. We also found that in the literature, sometimes researchers use different methods for different audiences. For example, let's say you're working on sexual abuse, for example. Some of the end users might be hesitant to participate face-to-face. So you can elicit your inputs online, and then you can use maybe a workshop or face-to-face meeting for the other stakeholders. So really, there is no one way. It all depends on your goals, your purpose, and the resources that you have. So once you have agreed on the stakeholders to engage, the next step, of course, is to agree on the prioritization mechanism. So we have the topics, we have the stakeholders. How will we prioritize these topics? Of course, one common way is to use criteria to rate the topics. So from your perspective, what criteria needs to be considered when conducting a priority setting exercise?
Feasibility, probably, like the feasibility of conducting, the knowledge translation product, the first one, and feasibility of change, like if the priorities, like a dream, sounds like a dream, and it will not be feasible to change something or to build up on this and changes. Maybe this can be one of the criteria. This is just my opinion.
So what is it? What did you say could be one of the criteria?
The feasibility of...
Yeah, of course, feasibility is indeed an important criteria that one could consider. Okay, in your opinion, what is the benefit of using criteria in priority setting as opposed to simply asking the stakeholders, okay, you are in the table, you are here, so tell me, please just select the topics that are most important to you. What's the benefit of having criteria as opposed to simply asking our stakeholders to select the topics that are most important to them?
It's so maybe it's because of to have the ownership from them, like to have the responsibility of the answer, like when they are providing the answer, they need to take responsibility that they are answering this through some criteria. They will feel more credible and more responsibility on their response.
Yeah, just to add, well, in addition to that, using criteria to do that helps to make it more objective than subjective. People would mention things and because of the way they feel about them, even though what we are considering is more, it has a lot of social components. However, it's important to have a criteria that helps you eventually come up with an objective focus, an objective priority, so that with that you won't fall into taking people's opinion just because it's mentioned. Issue of visibility, how many people is affected by this, so that you make sure that you're not leaving a more generalized problem to a sectional problem. That's my opinion.
No, this is excellent. In fact, this is very true. So the use of criteria is important for two main reasons. As you mentioned, it will ensure a more objective approach to the priority setting, and it will enhance the transparency of the entire process because people know that these are the criteria that you have used to prioritize the topics. So as we mentioned earlier, that stakeholders, they come to the priority setting process with their own preconceived ideas, their own hidden agendas, their values, beliefs, preferences. So if you don't have a minimum set of criteria to guide the discussion, I might end up prioritizing topics from an equity perspective, driven by the equity lens, whereas another person might only care about the economic and cost implication. So he might prioritize topics purely from an economic lens. And of course, this will introduce bias because there is no one standard way that we are doing or using to prioritize the topics. So the presence of criteria will help balance among these different values. And that's why it's important that when you select your criteria, you have to ensure that they reflect the values of your institutions as well as the values that you would like to incorporate into the priority setting process in order to prioritize the topics. Of course, the selection of criteria also depends on the purpose of the priority setting, on the level, whether it's a national, regional, or international exercise, and on your ability to define and measure the criteria in a common language. So it's important that the criteria is interpreted in the same way by different stakeholders. So do you have any question or shall we proceed?
No questions from my side.
No question.
So far, none.
Okay. So how are you feeling? Are you happy with the process? Are we going too fast?
No, quite good. Let's see.
Okay, good. So this slide is a summary of the list of criteria identified from the systematic review we have conducted on prioritizing topics or questions for evidence synthesis in health. We identified 20 relevant studies, and these studies mentioned 97 criteria that we clustered into 10 domains and 25 criteria. So you have domain 1 related to problem-related consideration. So this looks at whether the problem being addressed by the topic is of large burden, is of large public health burden, or is it of large economic burden, or is it a huge burden on the healthcare system? You have practice considerations. So this looks at the uncertainty or variation in practice related to the topic being addressed. Of course, the more uncertainty or variation there is, the more likely you are to address the topic, because this means that the use of evidence becomes important in trying to settle and addressing the uncertainty. But the practice consideration is more applicable to clinical topics. Existing systematic reviews. So you have criteria that look not only at the available systematic review, but is the systematic review of high quality? Is it relevant and is it current? Of course, this relates back to the issue of research gap analysis, where you have to look at your evidence base. So many studies, they include the gap analysis as part of the criteria that they use to prioritize topic. So if a topic has available systematic reviews, I might be more likely to address it in a policy brief. Existing primary studies. So this looks at the availability of primary studies and also the potential to change conclusions. So even if I have primary study, is the finding new in a way that it might change previous conclusion, or is it just similar to previous conclusions? You have criteria related to urgency. How urgently is the evidence needed? You have criteria related to implementation consideration. So how applicable is the research? Do we have the capacity, resource, and political will to act on the finding? So sometimes a topic might be ranked as important and relevant to your context, but maybe in terms of implementation, it is difficult to implement because maybe you don't have the capacity, resources, or political will. Then you are less likely to address that topic, because if you cannot take it to the implementation stage, then what's the use? So in many cases, it's important to at least include 1 or 2 criteria on implementation considerations. You have other studies that look into ethical and moral consideration. Do I have a social, ethical, or moral obligation to address the topic? So when we were working on the issue of access to HIV, we thought we had a moral obligation to address that topic. Of course, it's very important to check whether the topic is of interest to health professionals, is it of interest to consumers, is it of interest to national level stakeholders, regional stakeholders, or is it of interest to your team, to your own center? And you have the issue of impact. So will addressing this topic lead to improvement in health outcome? Will it lead to improvement in economic outcome? Will it enhance patient experience of care? Will it improve equity? Of course, this is a very comprehensive list of all criteria we could identify from the literature, and definitely you cannot, and it's not feasible for you to include all these criteria when you want to do your priority setting exercise. You have to select those criteria that resonate the most with your values and the values of the center, as well as the values you would like to incorporate into the exercise. And if you look across studies, the number of criteria range from 2 to 22, with a mean of 8 criteria per priority setting exercise. And at K2P Center, we have established a list of 14 criteria for selecting priority topics for knowledge translation products. So at K2P, in addition to proactively shaping the research agenda, we are increasingly receiving requests from policymakers and stakeholders where they are asking us for the best available evidence related to topics and work they are currently addressing. Of course, we thought it would be important for us to have criteria that would help us prioritize these different requests. So, and the criteria is also important because it will provide boundaries to the work that we do. And for us to accept a request, it should meet at least half of these criteria. So is the topic important? Has the topic already been recognized as a policy challenge? Because this will tell us that there is a political will to act on findings. So once we provide evidence, policymakers are willing to take it forward. Has the topic already been integrated in the policy cycle? So if you look at the policy cycle, you have the agenda setting, you have the policy formulation, policy adoption, policy implementation. So as part of my work, so is this topic already on the agenda and we want to take it into policy formulation or implementation, or is it not yet on the agenda and we have to advocate to put it in the agenda first? Of course, if it's not on the agenda, you would need to do more work to prove the relevance of the topic. Is there public interest on the topic? Is there sufficient local evidence? Why is this important? Because if you recall, during the workshop in Beirut on policy briefs and knowledge translation products, we said that Each product consists of 3 sections. We have the first section on the problem and its underlying causes. We have the second section on policy options or elements to address the problem, and the third section on implementation consideration. So if we don't have enough local evidence, it might be challenging for us to quantify and prove that there is actually a problem going on. So the more local evidence available, the more likely we are to address the topic. Are viable options available to address the topic? This is important because we don't want to end up prioritizing topics that cannot be addressed via policy briefs, for example. And for example, let's say one of the topic relates to establishing a minimum database for human resources for health. So in this case, I don't have options available to address the topic. This is more of an administrative and primary study. So in this case, I would drop the topic. It's beyond my scope. Is there an opportunity for change? So sometimes the topic might be important, but you don't have a window of opportunity. It's not the right timing. In this case, you might not address the topic at this stage. Is there important uncertainty about the topic and potential solution? This is important because the more uncertainty there is, the stronger the role of evidence in clarifying this uncertainty. Is relevant research evidence available? Of course, if I cannot find systematic reviews, I might end up not being able to produce my policy brief. Is there interest in informed deliberation about the problem and potential solution? So if we produce the policy brief, are policymakers and stakeholders willing to attend a dialogue where we would deliberate on the findings? Does the topic have a national and regional relevance? Is it feasible for the center to track the outputs and impact of the use of evidence? So at K2P Center, we are impact driven. That's why it's very important for us to tackle topics that we could prove and show that they eventually lead to outcome and impact. Sometimes you have to think about long-term versus short-term wins. And short-term wins, so sometimes, as you know, there are low-hanging fruit topic. Is it strategic for me to address this low-hanging fruit at this moment? And of course, is the topic clear and well-defined? So these are the criteria that we use at K2P. And as you can see, they are really tailored to the policy briefs and KT products that we produce. They address these technical issues, which will later facilitate the entire process. Of course, you don't have to include all 14 criteria. You can tailor it to your own context. For example, at Spark Center, where we produce systematic reviews, we developed the Spark tool to prioritize questions for systematic reviews in health policy and systems research. And the Spark tool consists of 22 criteria divided into 2 modules. We have the first module, which assesses the relevance of the topic to policymakers and stakeholders. So it consists of 13 criteria. The first 2 criteria look at the size of the problem. Criteria 3 to 6 look at whether the problem or the issue or the topic responds to the needs of stakeholders. Does it respond to the needs of the population, to the needs of decision makers? Does it respond to national health priorities? Does it align with the SDGs? Criteria 7 to 10 look at the expected impact of addressing the topic on health, equity, patient experience of care, expenditure. And the last 2 criteria look at the political environment. So is evidence critical? Is there a political will to act on the findings? Of course, if you are doing a systematic review, then you have another module, which is module 2, that is specific for the systematic review team. Just as in K2P, we have criteria, technical criteria for our policy brief, module 2 represents the technical criteria for conducting systematic reviews. So, but I'm not going to dwell into this because we will be having a webinar that is separate for systematic reviews. And the strength of Spark tool is the flexibility that it offers its users. So users can customize the tools to their own needs. So let's say you are interested in, assessing the relevance of the topic to your policymakers and stakeholders. You can end up using only module 1. You don't want to do a systematic review. In this case, you don't have to use module 2. Even within module 1, you can omit those items or criteria that may not be applicable to your own setting. So as you can see, we have a wealth of criteria that we can leverage upon. It all depends on which of these criteria resonate most with the values of our center and the values we would like it to incorporate into our priority setting meeting. Okay, so now that we have used the criteria and we have ranked and prioritized the topics, what do you do next? Unfortunately, the post-prioritization phase is the least utilized phase. So we tend to spend lots of time in the pre-prioritization and prioritization phase. We bring the stakeholders, we identify priorities, and that's it. We stop there. And in fact, the post-prioritization phase is the missing link when it comes to ensuring that the output of the priority setting exercise will eventually lead to influencing policies and practices. So once you have the priorities identified, the next critical step would be for you to write a report summarizing the approach that you have used and the priorities that you have identified as a result of the exercise. Of course, you then have to disseminate this report to all your stakeholders. In our case, we also publish them. We publish the priority setting exercise in peer-reviewed journal, and we also post them at K2P website. Of course, dissemination and implementation will help reinforce commitment and promote the translation of the output of the priority setting exercise into research projects that will ultimately improve the health of the population. Few priority setting exercises also incorporate revision or appeal mechanisms. And these are important because they allow opportunity for feedback as well as periodic review of the priorities to ensure they are up to date. And these are more likely to apply to these topics where the evidence rapidly changes or priorities rapidly change. So the revision mechanism will help ensure that you are responsive to changing needs and priorities. And of course, you have to monitor and evaluate the extent to which the priorities generated have informed current research or research funding, and the extent to which they have influenced policies and practice. And the monitoring and evaluation will demonstrate the value of priority setting. Why is priority setting important? So this is a summary, as I mentioned, of the priority setting process. As you have seen, it consists of the pre-prioritization phase, prioritization phase, and post-prioritization phase. Within each phase, we have different sets of steps that we can conduct. Of course, none of you is expected to do every single step. So the best thing is to look at this as a menu of options that you can tailor and apply to your own context. So yes, May?
Just one question. Sorry, Rasha, I thought you have ended with your slide. So just question regarding the dissemination. You mentioned that you are publishing the priority setting exercise in a peer-reviewed journals. Can you dip more down into this? So do you just publish exploratory papers, like to explain how the process has been gone, and what type of journals are accepting this kind of papers? If I understand correctly, yes, you mentioned that you are publishing the priority setting exercise in peer-reviewed journals. So can you deep down more in it?
We cannot hear. Maybe you're unmuted, Rasha.
She could be having network challenges.
Okay, can you hear me now?
Yes.
Okay. So yes, so thank you for the comment. I'm saying that in fact, journals are happy to publish about the priority setting exercises that you have conducted. And you will see in the next few slides when we provide examples, we recently conducted a regional priority setting on quality, safety, and performance management in primary healthcare in the Eastern Mediterranean region. So it was a regional priority setting exercise where we shaped the research agenda when it comes to quality, safety, and performance management in primary healthcare. and it was published in BMJ Global Health. We also did another priority setting where we tried to shape the research agenda around health system with a focus on health financing, human resources, and the non-state sector, and this was published in Harvard's Journal. So there's no any reason that would hinder you from publishing your priority setting exercise as long as it's being done in a systematic and transparent way. And one of the motivations for us to publish it is, of course, in addition to the learning experience that other individuals from the countries can gain, is for transparency purposes so that people can know really what went on and what are the priorities. And it's also an opportunity for other researchers in our country and the region to know what are the priorities when it comes to a specific area so that they can also address them. So we don't necessarily have to implement we don't necessarily have to address or implement all the priorities that generate. We can give an opportunity for other researchers to address some of the priorities as well.
Thank you, Rasha.
Thank you. Okay, so a question. Do you always have to conduct formal priority setting exercises to identify policy relevant topics? What do you think?
I think yes. In most cases, yes. It will keep us on a safe side, especially with criteria's part. I think it's very important, and thank you for sharing your experience in terms of engaging some kind of criteria while setting the priorities, because sometimes I agree with you, policymakers just think, okay, this is priority, I need to do something with this, and this is my priority, and criteria will frame their opinions maybe, or I don't know, thinking.
Thank you. So, of course, as you can see, formal priority setting are important, but as the reality hits in, it's not always affordable to hold formal priority setting exercises. Also, given the dynamic nature of the policymaking world where new priorities might suddenly emerge, it might not always be feasible to host formal priority setting exercises. So when we launched Spark and K2P Center, one of the first things we did was to host a formal priority setting exercise. This is because we wanted to kickstart our work and we wanted to demonstrate the value of the work that we do. And the best way was to respond to the needs and priorities of our stakeholders. So we brought them, we did the formal priority setting exercise. We were able to identify the priorities for within the next 1 to 2 years. And this allowed us to kickstart the work, to respond to the priorities that were generated, to showcase the value of the work we do. And over time, we were able to gain the trust of our stakeholders and policymakers. So what happened? We started to shift from a formal priority setting exercise to informal priority setting exercises, which can take the form of informal discussions, side meetings, direct requests. Of course, to reach this stage, you must have proven yourself and you must have had some, you should have ensured the trust of your policymakers and stakeholders. So now in many cases, we would go to a meeting and then as part of side discussion, one of the policymakers or stakeholders would come to us and tell us, we are working on this topic. We would like to know what the best available evidence is around the topic. And this is exactly what happened when we were working on community-based health insurance scheme. So the general director at the Ministry of Health came to us. We were in a meeting. So they told us they are working on community-based insurance. They want to see what's the best way to implement it. So we did a policy document around barriers and facilitators to implementation of community-based health insurance scheme. As I mentioned, increasingly, we are now receiving direct requests from policymakers and stakeholders. So they are working on a topic. They would like to know what the evidence says around it. So it becomes a one-to-one discussion or through email or through direct calls. So what I'm trying to say, you don't always have to stick to the formal priority setting exercise. Of course, the formal is important, particularly when you are launching or you are still starting as a center. You have to, policymakers will not come to you. You have to be proactive. You have to try to shape the agenda. But over time, you can start receiving direct requests, one-to-one requests through side meeting, informal discussions, and calls. And at K2P, we also have the K2P press tracing service, which tracks health topics reported in national and regional newspapers and reports. And it reports on the frequency of the topics. So this is a sample of the press tracing service that is generated on a monthly basis. If you can see, for 2 consecutive months, we had the issue of environment as the top priority topic in the newspaper. And when we try to break down what is it that is being covered in the environment field, we found that if you look at the blue pie chart, 70% talked about the waste crisis. And from the press tracing, we actually decided that we actually were prompted to work on the issue of waste crisis. We asked the minister, and they were very responsive. And in fact, we are now working on a policy document with the parliament around the issue of waste crisis to see how we can address it. So the point we're trying to say is you don't have to stick to one way. You have to be ready and responsive to the needs of your stakeholders, whether it's either through formal, informal priority setting, or press tracing. So I would like to pause now to see if you have any questions before we move to the third part related to real-world examples of priority setting practices. Do you have any question related to the steps involved in conducting priority setting exercise? Shall we move on?
Yes.
Okay. So before we start with the case studies, I just want to revisit the impact-oriented approach that we use at Spark and K2P to support evidence-informed health policy making and practice. And we have already showed you this in the workshop in Beirut. But the point of this slide is for you to see that priority setting is just one component of a comprehensive approach to achieve health impact. It's just the beginning. So once you prioritize your topic, the next step is to look for systematic reviews and primary studies addressing your topic, and then incorporate them in knowledge translation products like evidence briefs for policy, policy briefs, rapid response products. And then you have to leverage different knowledge uptake activities like policy dialogues, citizen engagement, advocacy, media, and political engagement to promote the uptake of evidence. And then you have to follow up with the policymakers and stakeholders through monitoring and evaluation to see the impact that you have achieved. So the take-home message from this slide is that priority setting is not an end goal. In fact, it's just the beginning. It's the very first step that you should do if you want to achieve impact and if you want to influence policy and practice. You have to ensure that the topics you are addressing align with the needs of your policymakers and stakeholders. And the best way to do it is through priority setting. So we're now going to move into case studies. So we have 4 case studies. Lama will start with the first case study on Syrian refugee crisis. Lama?
Okay, so I will start by the first case study on Syrian refugee crisis before Rasha can proceed. So as Rasha mentioned earlier, there's no one approach or engagement method for priority setting exercise. You can choose your approach or your method depending on the situation, on the purpose of the priority setting, on the resources you have, on the context, and on the situation. So in addressing the Syrian refugee crisis in Lebanon, first, in the pre-prioritization phase, we decided on the scope. We wanted the scope to be on a national level. We didn't want to have a regional scope for our priority setting. And before going into the prioritization phase, we conducted a literature review and stakeholder consultation to elicit the problems related to refugee crisis or Syrian refugee in Lebanon. And we generate a list of potential themes before going to the actual prioritization phase. We invited around 25 stakeholders and policymakers from UN agencies, international NGOs, national NGOs, government agencies, administries, humanitarian agencies, and funders to this priority setting meeting. It was a formal priority setting meeting back then, and we followed a consensus-based approach to generate a list of priority topics. So, as you see in this slide, in the formal priority setting exercise, we had like this a meeting. If you can see, stakeholders were convened around the table to generate a list of priority topics, and the priority topic identified back then was the coordination. There was a problem in the coordination between different organizations and agencies providing health services in a humanitarian crisis in Lebanon. So to proceed in the post-prioritization phase, after we identified this topic as a priority, which was the coordination, we moved into evidence synthesis. So we conducted 2 systematic reviews around coordination. And why systematic reviews? Because we looked at the literature and we found that there are no systematic reviews addressing the issue of coordination between organizations working in humanitarian crisis in the literature. So we conducted 2 systematic reviews. And these systematic reviews fed into the development of a briefing note on promoting the access to essential healthcare services for Syrian refugees in Lebanon. And this briefing note and the findings of this briefing note was presented in a national policy dialogue where stakeholders and policymakers agreed upon a set of next steps and actions. And actually, this discussion and this agreed upon next steps led to an impact where the Ministry of Health recruited a refugee health coordinator at the ministry. And also it led to strengthening the information system on refugee health among this organization. So this slide presents the post-prioritization phase that we followed after identifying a priority during the formal priority exercise that we conducted. Now I will give the floor to Rasha to present the other case studies.
Thank you, Lama. So moving on to the next case study on quality, safety, and performance management in primary healthcare in the Eastern Mediterranean region. So this project was conducted with the Ariadne Lab at Harvard University. And of course, the purpose was to generate a policy-relevant research agenda related to quality, safety, and performance management in primary healthcare in the Eastern Mediterranean region. So it was the first study of its kind because prior to that study, we did not know what the priorities are when it comes to strengthening quality and safety in primary healthcare in Lebanon and our region. So it was very strategic to do a formal priority setting exercise that will help shape and set the path towards strengthening quality and safety of primary healthcare in our region. And of course, the scope was regional. And as part of the pre-prioritization phase, we had to generate an initial list of topics that will feed into the formal priority setting exercise. To do that, we conducted a comprehensive literature review. Specifically, we did a scoping review to identify the areas where there is sufficient research and the areas where there are no sufficient research when it comes to quality, safety, and performance management in primary healthcare in the Eastern Mediterranean region. And through the scoping review, we were able to generate an initial list of 46 potential topics to address. Of course, we subsequently refined and merged the list, which brought the topic down to 37 topics. And these 37 topics moved into the prioritization phase where they fed into the actual meeting. So in the prioritization phase, of course, we had to involve stakeholders in an actual face-to-face meeting. In this case, we did four national priority setting exercises, one in Lebanon, one in Jordan, one in Bahrain, and one in Tunisia. For each priority setting exercise, 10 to 18 individuals were purposefully selected based on a sampling framework that we have adapted at K2P Center. So the sampling framework, it includes 5 stakeholder categories: senior and middle level policymakers from the Ministry of Health and other relevant ministries, primary healthcare directors and managers, healthcare quality experts, researchers who are active in the realm of health system research, representatives of the non-state sector who are active in trying to shape and influence health policy and systems, as well as patient representatives. So we use this sampling frame to strategically select 10 to 18 individuals from each country. As part of the former priority setting meeting, we selected 5 criteria. And to be able to use the criteria in a meaningful way to generate information from the stakeholder, we developed a priority setting tool. And so this is a sample of the tool that we have developed. So basically the tool will ask about the position of the stakeholders, and then it will show them the criteria that were used along with the definition for each criteria. And we have translated the tool into Arabic. So in most of the times we translate our priority setting tools into Arabic. And stakeholders can either use the English or the Arabic version. And this is an example of some of the topics that were generated. So if you look at the first column, you have the topics. And if you look at the first row, you have the 5 criteria. And within each criteria, policymakers and stakeholders would rank it as low, medium, or high. So if we take the first example, impact of pay-for-performance scheme on provider competency and clinical outcome. Is this relevant? So they would say it has low relevance, medium relevance, or high relevance. Is it urgent? Low urgency, medium urgency, high urgency. So they would rank each topic against these 5 criteria using this 3 scale. And if you look at the topics, we grouped them by themes, but it's important to remind you that we did not prioritize the topics by themes. For example, in the case that Lama shared, we were interested in the theme of Syrian refugee, and we generated topics within that theme. In this case, policymakers and stakeholders were free to rank the topics across the different themes, but we grouped them by theme just for convenient purposes and to facilitate filling of the tool. But it doesn't mean that they should focus on pay for performance. Maybe none of the topics under pay for performance are relevant. So the prioritization is across themes. It's not within themes. Okay, so no, I have to go back. Okay, so once we have ranked the priorities, we ended up with a ranked list of 37 topics against the selected criteria. And out of these, we selected the top 5 priority topics. Of course, one of the easiest way to calculate the top 5 topic is to generate the mean and standard deviation for each topic. And those that get the highest mean and standard deviation will eventually be designated as the highest ranked priority topics. We then proposed an implementation plan addressing the top priority question. And in the next step, we plan to actually move on with the agenda and address the top ranked topic, the top ranked priority. And we will then proceed to monitoring and evaluation to see to what extent this priority setting is informing research around quality, safety, and performance management in primary healthcare in the Eastern Mediterranean region. So I'm going to move on to the 3rd case study, which is on identifying regional research priorities related to health financing, human resources, and the non-state sector. So this was conducted in collaboration with the Alliance for Health Policy and Systems Research. And it was the first priority setting exercise in health policy and systems in the Eastern Mediterranean region. And it involved 9 countries. So for the generation of initial list of topics, we conducted a review of the literature where we looked at primary studies related to health financing, human resources, and the non-state sector when it comes to the region. We also looked at the website of international organizations like WHO, as well as reviewed documents from ministries of health. We then conducted thematic analysis of the data, and from the thematic analysis, we were able to generate potential topics for each of the themes. So in this case, we had 3 themes, 3 predefined themes. One for human resources, one for health financing, and one for the non-state sector. We then generated potential topics within each theme through a combination of literature review as well as through interviews and focus group discussions with policymakers and stakeholders. In the next phase, which is the prioritization phase, we held a regional priority setting meeting in Lebanon where we invited 26 policymakers, researchers, and representatives of the non-state sector from 9 countries. And the purpose of the meeting was first to validate the list of priorities. So in day 1, policymakers and stakeholders were asked to validate the list of priorities that was generated and to add any additional or missing topic. In day 2, we proceeded with the actual ranking of these topics against 5 criteria that we have selected. And so this is the sampling framework so it's a standardized sampling framework that we use at K2P. So whenever we want to select stakeholders, we have to select them from senior and middle level policymakers from the public sector, representatives from professional associations and health service organizations, researchers, and representatives of the non-state sector. And these are the criteria that we have selected to rank each topic against. So its relevance, urgency, feasibility, applicability, and originality. And the questions or topics with the highest mean scores were then designated as the top research question within each theme. So unlike the previous case on quality and safety, here we came with predetermined thematic areas. So policymakers were divided into 3 groups, one for the financing, one for the human resource, and one for the non-state. Whereas in the example on quality, safety, and performance management, they prioritize topics across the themes. So it's not by thematic areas. And I'm not saying one is right or wrong. It's just highlighting the diversity of ways that you can approach a priority setting. Of course, as part of the post-prioritization phase, we disseminated the ranked list of priorities to all our stakeholders. We also published the paper so that it's now available to the public. And many of the priorities that emerged were actually addressed by researchers from our center, as well as researchers from the other centers and countries involved in the study. So I will move now to the final. So the mouse is not working for some reason. Okay. So this is a sample example of some of the topics prioritized under the theme on the role of non-state sector. Of course, you can access the study if you're interested in more details. So I'm going to move now to the 4th case study on informing salt fluoridation and iodization law. So this is an example of an informal priority setting exercise. So the Minister of Public Health actually contacted us and they simply asked us, is salt fluoridation a viable solution when it comes to addressing dental caries in Lebanon? This is because salt fluoridation law was assumed to come into effect in December 2014, and this created lots of controversy among the Lebanese population. So proponents of the law argued, they said that salt fluoridation is a cost-effective way to address dental caries in Lebanon, whereas opposers of the law said that in Lebanon we already have the population is already exposed to high level of fluorides through drinking water as well as through toothpaste. And also the Lebanese culture, we eat lots of salt. So if we fluoridate and we mandate fluoridation of salt, this would lead to toxicity because we will exceed the threshold level at which fluoride becomes toxic. So the minister was really confused. They didn't know what to do. They contacted us and they simply asked, is salt fluoridation a viable option in Lebanon? Accordingly, because it was very time sensitive, we did a 30-day rapid response product. We sent it to the policymaker. We did personalized or one-to-one meeting with the Director General. We exchanged email, and ultimately this led to stopping of the law. An informed decision was undertaken to conduct a thorough assessment of the readiness of the Lebanese context for salt fluoridation, and eventually the law was stopped. In the bottom line, you can see another example on salt iodization, but I will not dwell into the details because of time constraint. So this is an example of an informal way of doing priority setting. So this is a simple true or false question. There's no consensus on a gold standard when it comes to setting priorities for health research. What do you think?
True.
True.
True. Efforts should strive to achieve best practice for
True.
health research priority setting. What do you think?
True.
So this is a bit tricky because, in fact, it is not appropriate for us to try to come up with one best practice for a priority setting, because ultimately the priority setting will be determined by the purpose, the context, and your needs. So we shouldn't strive to come up with one best practice. We should embrace the diversity and the different ways that we have when we want to conduct priority setting. Priority setting is an end goal on its own.
False.
False. False.
Definitely false. It's the first step. In fact, if you recall the diagram, it's the very first step of a comprehensive approach to achieve impact. Prioritization is a cycle: selecting priority topics, implementing, disseminating, evaluating, and afterward updating priorities. What do you think? Is it a cycle or is it a one-stop activity?
It's a cycle. It's a cycle.
It's definitely a cycle. So it's dangerous to just think of priority as a one-time event and that's it. You have to constantly update, follow up, you know, so it's a cycle.
More so, bearing in mind that priorities change from time to time.
Exactly. That's the importance of having a revision or appeal mechanism. You can be responsive to changing needs and priorities. So I'm going to end with very few slides. So just as a recap, we need to get the priorities right. As we saw, priority is the first step. If we get the wrong priorities, we will end up doing products that do not address the priorities of our stakeholders, nor do they resonate with the context of the country, of our country. It's important to use the right timing. Sometimes you have the right priorities, but the timing is not correct. So you have to ensure that you identify and leverage on policy windows of opportunity. It's important to maintain objectivity. You have to be transparent. You have to ensure appropriate representation of expertise and stakeholders, select relevant criteria to focus the discussion around setting priorities, decide whether you want to use a consensus-based approach or a metrics-based approach, importance of agreeing on what are the outcomes of interest. And then, as part of the post-prioritization, you have to write a clear report that discusses the approach used and the generated list. You have to share it with key stakeholders, proceed with producing your knowledge translation products, and plan for monitoring and evaluation. So as next step, it is your turn to develop your own tailored priority setting approaches and tools based on the information highlighted from today's webinar. Of course, you can either start with an existing approach. As we said, there are lots of approaches in the literature that you can leverage on, but none of them is really tailored to health policy and systems research or policy briefs and evidence synthesis. But definitely you can use them as a starting point and tailor them based on today's discussion. And the K2P team will follow up with you in 1 to 2 weeks to see whether to provide input and additional support. So we have we are on time. So I'm going to leave the floor for you if you have any question or clarification from your end.
Thank you very much for the delivery. Can you look at, just go to the second to the last slide, the slide before this one.
Yes. This one?
Deciding if you want to use a consensus approach. Okay, no, the one before this.
Yes.
All right. Yeah, where you talked about deciding whether you want to use a consensus-based approach or a metrics-based approach. Can you throw more light on the two, consensus-based approach and metrics-based approach?
Okay, so personally at K2P, we learned that it's better to go with the metrics-based approach. But if you look in the literature, sometimes, so the metric-based approach, it's related to criteria. So you have the criteria and then you calculate the means and standard deviation in order to identify, in order to generate a ranked list of priority. However, if you look at the literature, sometimes they don't always use criteria. They go for a consensus-based approach. So in this case,
Okay.
you ask for consensus, you try to reach consensus, but at K2P, we try to avoid it because, as I mentioned, there are lots of biases. People come with preconceived ideas, values, and if you don't have a strong facilitator, you might end up having the priority setting dominated by few or strong policymakers who will try to impose their views. And others might.
Exactly.
That's why we try to avoid it. But for transparency purposes, we are putting everything that's out there. We at K2P use criteria and metrics based, but we are saying that sometimes you can use consensus, and this is mostly the case if you have one thematic area, let's say Syrian refugee, and you want to identify topics within that thematic area. Maybe in this case, you can use a consensus-based approach, especially if you have a low number. But if you have a large number of stakeholders, you have lots of thematic areas to consider, then definitely you have to go for the metrics or criteria-based approach.
Okay, that's quite clear. I was actually looking at it from the point of view that, from experience, once we have to do a priority setting, formal priority setting, that it would necessarily have to involve the metrics.
Yeah.
What I'm seeing today, yeah, sure, that's my orientation before now. You necessarily have to involve the metrics.
Thank you for your question. So any additional questions or reflections?
Thank you very much, Rasha and Lama. This was very helpful webinar for us because we face these difficulties in our practice. And for example, I didn't know if we could have a list of a priority topics that along with us, and that should be defined prior to the meeting. And this is a very good new knowledge for me, and I will use it in my practice. I think we will use the Croatia team.
This is excellent to hear. So definitely you can have a preliminary list of topics or a preliminary list of thematic areas. It's up to you. You can go into your priority setting with a predefined thematic areas or with predefined topics. Definitely up to you. And is everyone fine with the timeline? So 1 to 2 weeks to follow up on the draft priority setting approach and tools that you will each develop as part of building institutional capacity.
Yes, sounds normal.
So the approach is the overarching framework, and the tool is just similar to the tool we showed you earlier, which includes the criteria and the scale. So this is just
Rasha, may I ask you, are you going to share the presentation with us?
Yes, we will share it with you.
Thank you.
Thank you.